Philippine Nurses Association of Nevada now brings you Filipinars, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello, Filipinars listeners and followers. Thank you so much for tuning in today. We hope that you're all keeping safe and very well. And as you know, Filipinars is brought to you as a public service project of the PNANV, or the Philippine Nurses Association of Nevada, in collaboration, of course, with PHLV Radio. So, the health of women and children is very vital. It's vital to creating a healthy world. Maternal health refers to the health of women during pregnancy, childbirth, and postnatal period. And each stage should be a positive experience to ensure that women and their babies reach their full potential for health and well-being. So this is a subject that is of great interest these days due to the shortage of healthcare professionals, especially in this field. So the PNANV is actually hosting an educational seminar to address the ways of proper maternal and child health on March the 2nd. It is themed, Get It Right from the Start, Maternal and Child Health. So we are inviting you all to this educational seminar. This time, the PNANV is collaborating with two other nursing organizations, the FOPARNA NV, or the Filipino American Advanced Registered Nurse Practitioners Association of Nevada, and APINA, which is the Asian American Pacific Islanders Nursing Association. Again, we are inviting you to this program, and we'll be showing you the flyer on screen. We will have some very interesting topics and speakers and vendors to this event, and so we are encouraging you to attend. It will be held at the Optum Healthcare Chairman's Auditorium at 2716 Tenaya Way in Las Vegas. So please come on. Okay. So the birthing experience of an expectant mother and her family is extremely important. The traditional way of giving birth takes place in the hospital. However, there are other alternative ways of birthing places and birthing care. Traditionally, we have the OB physicians, the neonatologists, the maternal and child health nurses, and professionals monitoring the pregnancy and the birthing experience. But we also have other maternal and child health providers, such as midwives, Montrices, and Doulas. And so we are exploring this today. And so we have invited two ladies who can enlighten us about the alternative birthing care experience, actually. So please welcome Ms. Shannondoah Dartsch and Ms. Ruby Joslin. Welcome, ladies.
Hi.
Hey, hi. Thank you. They will also be guests at our seminar. So anyway, Ms. Shannondoah Dartsch is a DEM. Otherwise, it's called DEM stands for Direct Entry Midwife, and she has been a midwife and a doula and a Montrice with a background in massage therapy and hypnotherapy and hypnobirthing. So this is all sort of kind of new to me. So Shannondoah, can you give us a little bit more about yourself? Let us know about more about yourself. Gosh, I can't talk.
So I've been, I was at my very first birth about 19 years ago now, and steadily started doing more and more with it and became a doula first. I was already a massage therapist and a hypnotherapist, and so they really helped me become a really good doula because I was able to use those things, which a lot of doulas learn a little bit of massage, but I already knew, the full thing,
Okay.
And then hypnotherapy helped me because I could help with hypnobirthing, which helps a mom relax and get in a different state of mind for the whole labor and delivery part. So then a few years after that, I became a midwife. And I trained for a really long time because I'm a full-time mom, a full-time doula. And now I'm a midwife and a doula and a Montrice. So when
We'll talk about it later.
Yeah, yeah, exactly.
So you've been doing this for 19 years. Wow. That's great.
Well, I did my first birth 19 years ago, but I actively was a doula starting about 17, 18 years
17, 18 years. That's still a lot of years, right?
Yeah.
And of course, we have Ms. Ruby Joslin, who is one of the moms who has had experience in alternative birthing care under, of course, Shannondoah here. So, Ruby, welcome. And can you tell us a little bit about yourself?
Yes. I'm now full-time mom of two. Shannondoah is the one who essentially brought both my babies here. I'm very pro just natural. My mom had 8 kids at home, all natural. So that kind of sparked the interest of just doing it at home, and that's always kind of what I knew. And then I had my sister. She had 4 kids, all at home. I was like, it was very common for me. That's kind of the way I knew. On top of that, I have a big fear of needles, hospitals, things like that. So I used to just pass out at the side of a needle, like butterfly needles would pass out after having the babies and getting blood and all that. It, diminished a little bit, but needless to say, I wasn't big on wanting to get an epidural. So I just knew I want to do it natural. I'd never had a baby though, so that was understandably scary, as it is with most first-time moms. And I actually just started Yelping, like hypnobirthing, like doulas, because I didn't really know where to start. My mom literally just had them at home, and my dad delivered my youngest sister.
Wow.
So I want to do it natural, but then my husband also was a little bit more hesitant about it because it's his first baby too. He's not he's not sure about the whole process. He's more comfortable in a hospital, which is why I was like, okay, I'll find a doula. So then I came across Shannondoah, and she said great reviews. So I was like, okay. So I hit her up, and the rest is kind of history. I guess not history yet. I haven't told you.
Good.
But
well,
we can get into it.
We'll get into that
get
later.
Into it.
But I'm so glad you were able to come in today and speak here on the podcast with, of course, Miss Shannondoah here. So let's start with you, Shannondoah.
Okay.
What is the difference between a midwife, a doula, and a Montrice?
Okay, so a midwife is a professional who plays a critical role in the healthcare of the pregnancy, before, during, after. So even midwives do, which is a little different from an OBGYN. We do care for up to 6 weeks, in some places 8 weeks, with the mom and even the baby. That is more of a medical professional, right? So we deliver the babies, and there's many different kinds. We'll talk about that in a minute. A doula is more of a support person, and they support in so many ways, but physical, mental, everything you can imagine, and it's a completely different role. And then there's a Montrice, which is actually like a middle ground. So all Montrices are midwives, but not necessarily, and when they're acting as doulas. So meaning, say I take a mom on, but she knows she's going to have a hospital birth, but she still wants to have the care of a midwife while she's pregnant. I would still do prenatals with her while she's still seeing her doctor. And then when she's in labor, I can check her cervix if she wants, if she requests it. I can check her blood pressure, listen to baby, make sure everything's safe at home, because midwives, doulas, Montrices, we don't take risks. I don't take risks. Not with a baby's health, not with a mom's health. So if we can pay attention to those things, it's a lot easier to get to the hospital when you need to, and you can wait longer if you know that everybody's safe. And when you're not in a hospital, it's easier not to have all the interventions, which we can talk about later.
Right.
So when you're at home, you're working as a midwife. But then when you get to the hospital, you become a doula. So that's a Montrice. A Montrice is kind of that middle person that can do both.
That has the clinical and the support function.
Absolutely.
Okay. All right. So let's see. So these patients or these would-be moms would still be undergoing prenatal care with an OBGYN. Is that correct? And
yes.
Then when do you all come in?
So yes and no. So it also could be one of my clients as a midwife. I could be taking care of them, and then I see something's happening that we have to transfer to the hospital. So
I see. Yeah.
Whether her blood pressure is going up, the baby doesn't sound, whatever it could be. If I feel like anything's off, we're probably going to transfer to the hospital.
Okay.
And once we transfer, then again, I become the doula support person.
I see. Okay. Well, this takes me back to when I first graduated nursing school in the Philippines, because we were obligated to spend 6 months of rural, not training, but actually helping out in the rural areas. And I had the experience of going with a midwife to somebody who had called and said, well, they were giving birth, and we got there and the baby was breech. So so we ended up taking her to the hospital. So that was years and years ago. I can't believe it's still going on, and it's really cool that there's a choice here to be made, right?
It's the great thing is that we do have choices depending on, I mean, I can't speak for every state. Obviously, every state has different rules. Every given counties, but for our state, we're lucky because, a lay midwife can practice as CM, certified nurse midwife, CNM, CPM. So we could talk about that later too.
Yeah, so there is what you call a CNM, which is a certified nurse midwife, right? They have undergone nurse training, and then they actually hone in on the midwifery practice.
Yes, and they have to be certified as a midwife as well.
So both as a nurse and as a midwife.
Right.
Okay. And so what is the difference between a CNM and a CM, which is a certified midwife?
Right. So the main difference is the training. So obviously, not obviously, but a CM is not a CM is not a nurse.
Yes.
So
correct.
that's the biggest difference. So a CNM can deliver in a hospital.
Oh, okay.
Most CNMs, CPMs, which is the certified professional midwife, DEMs, and lay midwives, which a DEM is direct entry, which means that a CPM, a CM, and a lay midwife can all be direct entry, which means it's basically on-the-job training, then it depends on what kind of other certifications or schooling you've had that makes your your certification or
that you would allow you to be called a DEM, or
exactly.
CPM, or
so the big difference there is their training, and then what and where they can practice. So a CNM can practice in a hospital at a birthing center, but they're not supposed to be doing home births necessarily if they're practicing as a nurse still.
Okay.
But and then, or they don't usually, but not in Nevada. Usually the ones that do home births are, I don't know about other states necessarily, so I can only speak to where we're at.
I see.
And then a CPM and a CM and a lay midwife can all deliver at home, but then the CPM and the CM can deliver in a birthing center, and so can a nurse midwife. So...
But they can't do it they can do it in the hospital as well?
They can't deliver in the hospital.
Cannot deliver in the hospital because they will not have
in the
privileges.
state.
Not in the state. Okay. So I guess there's a lot of conditions, in every state,
Yes.
which is good. I'm just glad that you guys are here because, definitely we are in need of, professionals that can help with moms
Yes.
and their families. Okay, so that's what a midwife is. So what is a doula?
So a doula, depending on if you're just a doula,
definition,
you're doing
right?
yes. So a doula gives support, mental, physical. They give a lot of like education. I personally like to show my moms or help my moms learn about how to take care of their babies, and moms and partners, how to take care of their babies. I show them, different positions and what pushing is really like, and all the things that we're going to do ahead of time. But also when they're in labor, you're giving that full support, but you're giving it throughout the pregnancy. You're giving them support during labor, and you're giving it to them after postpartum too, for a short time, unless they hire you as a postpartum doula, which we're not talking about right now. But
We will probably go there. But, yeah.
So they support in every way they can to help keep mom calm, to help the fears become really real, especially first-time moms, and that is what really causes the discomfort or the pain response in your body. Is you're fearful. So we try to keep that down, and they've also done studies that show that when somebody's with a mom the whole time, and like a doula is, it cuts down on interventions, it cuts down on time of labor, and it helps with the your lactation, with your milk coming in, and how long a mom can breastfeed for. Just having that support makes such a huge difference. And of course you become like family, like they trust you. So having someone you trust is so important.
I get it. I get it, because if you are calm and you have no worries, and somebody else is like keeping you calm, then the more you will have a positive outcome, perhaps, with the birth, or maybe even a positive reaction to what you're undergoing, right?
Right. And
Cool.
one of the most important things we do is we're advocates, which means that we have a lot of medical knowledge. We know what's going on. We've done many births. Even the new ones know what's happening, even. And they've studied hard. So they understand what's going on in the birthing room. So in a hospital especially, it's important to have that advocate. And at home births too. But at home births, the mom is in that comfortable space. They they know what's happening. Nobody's pushing their beliefs or what they think on them. I'm not attacking anybody, but it does happen.
Yeah, it does happen. Yeah.
Yeah, and so we advocate, and we're kind of that middle person to like explain things to mom and dad, and but also help talk to the nurses if they want us to, or to the doctor if they want us to, because sometimes they're not comfortable.
Right. So I know right now we're only going to talk of the two places that we kind of know of. We're not going to go to the birthing centers right now because
because I don't
that's
do that.
too different. That's totally different. So as we know, there are like two places where babies can be born, the hospital or in the home. So what is the role of a midwife, a Montrice, or a doula in the hospital versus when you are in the home?
So, me personally, if it was a CNM, she would be basically like a doctor role, but a more natural role, right? So she's trying to listen to the mom's wants, needs, and do what she wants. But I am not a CNM, so I'm not going to speak for them. But as a midwife, a DM, when I go to the hospital, I am more of that advocate. I'm more of the support person. That's what we do in the hospital, because we don't have the right to practice in a hospital.
Correct. Okay. So, but in the home, you're in total control.
100%.
100%.
Yes. Well, mom is, and then we're supporting mom, and we have no control over that part. But
Well, do you have a preference on where you would rather support the moms, the hospital or in the home?
Of course.
I'm going to say home, right?
It's a home births, yes. But yeah, for my mom's sake.
For your mom's
For the
sakes,
mom's
yeah.
sake, it's just a lot less stressful for them. Mm-hmm. They're already in their home environment.
They're comfortable
they're comfortable. Yes, they don't have an epidural or medication, like, on standby, but it's just so peaceful. Like, all the births I do, and Ruby could speak to this.
Yes, and I was going to...
It's amazing to just see them, like, I mean, it's like a spiritual experience every single time. I love it so much because it's
great.
So cool to see these women come into their own power and them work so well with their babies and listen to their bodies and not have anyone else telling them what their bodies is telling them to do, but they are listening to their bodies and they're moving through that.
It's true.
Very good. So we have Ruby here, who has been a mom. You have a couple of birthing experiences with the help of Shannondoah here.
Yes.
Okay. So can you tell us about that?
Yeah. The first one was, like I said, going to be in a hospital because me and my husband just agreed that was more. We'll do it natural still, but we'll do it in a hospital because it gave kind of him. I mean, me too, but more so him, like, peace of mind for our first time. So we did the hospital route. I had Shannondoah. She would come over for, like, hypnotherapy sessions, which essentially kind of just like a meditating kind of process of doing, like, massage and just kind of giving you, like, an idea of, like, how your perfect birth would be. And just so you can kind of get in that headspace of almost like manifestation of what's gonna.
It's like guided meditation.
Guided meditation.
Yeah,
that's
so
cool.
that she would come over for those appointments. Meanwhile, I was still doing all my appointments with my OB.
Yeah.
And then when it came time to deliver, we called her and she met us at the hospital, and then she was there just really, like she said, to be your advocate because, especially for me, when I get in a hospital setting, I feel so just like I'm just completely at their mercy. I feel like I don't have a voice. I feel like it's all just up to them. We are in the hospital. These are the rules. So it was really important for me to have somebody to be there speaking not only on my behalf, but to calm me down, to be there to kind of like, not like your mom, but kind of like anything that's said to me and I have questions about, I can kind of turn to her and she knows what's going on. She's been there hundreds of times. She knows the process. I don't. It was my first baby. I don't know what I'm doing. So that was my first experience in the hospital with her because I still wanted unmedicated. I didn't want an epidural. I didn't want to be pushed any extra unnecessary procedures to happen. I didn't want to be induced. I didn't want to, but I don't know how to say that or even necessarily know if that's what's going to happen at some certain point without her there. So
that's the advocate part. Okay.
So that's what was so important for me to have her there in the hospital birth.
Right. Now, you had one in the home as well. So how was that different from your hospital experience?
Oh my gosh.
It was so
Put you on the spot here, Ruby.
Yeah, so the first one was still good. I still consider it a success at the hospital. It was a lot more rough. I still labored at home till I was at like 8 centimeters. I went to the hospital and just immediately froze up. Once I got in the hospital, I was given like IV, you have the monitors on, it's just strangers in and out of the room, and I just froze up. And that whole process, I was in the hospital for maybe 18 hours. It was a long time, 18 hours. Then my second birth at home, I went into labor in the morning. I was like walking around my kitchen, making snacks. Then I was like, these are feeling a little bit more. So then I started timing it. I was in maybe active labor 2.5, 3 hours. I called up Shannondoah and I was like, here's the pattern of what's been happening, my contractions. She's like, okay, I'll come back over. So from probably 2 p.m. to 5, I was in labor, and then we had the baby at 6.
Yeah.
Wow, that's the second baby.
Yes.
And I was there that morning.
Yeah, she was there that morning.
She wasn't in active labor yet, or labor at all.
We were like,
so it was
could be
so
tonight,
fast
could
when
be
it
tomorrow,
happened.
but like, yeah, and I was like, I think I'm going to labor, so I just like filled up my tub. I just like labored the whole time just in my tub, and then by the time I moved to like, because I had a water birth, so they set up the tub and everything, and by the time I moved from my tub to the birthing pool, it was like 15 minutes, and I had him.
Yeah. Oh, okay.
It was so fast,
huh?
Yeah.
Oh my God! If I could.
It was amazing. I mean,
it was like perfect,
peaceful, beautiful. Just a couple pushes. Second time moms, it's a lot easier than first time moms. So first time moms, it does take longer, like she said, 18 hours. It does take a little longer for first time moms. Yeah. And once our body opens up, it becomes easier each time. So that second time, but her body just like now she's a precipitous labor.
Oh wow, that is such a different experience. I had 2 kids, and the first one was like I was in so much horrible pain. I was, just give me the drugs.
Yeah.
No, I did have an epidural thing for the first one. So, but talk to us about the water birth. You said was it water birth? How is that?
Oh my gosh, amazing! I recommend to everyone, like, if you can.
So you fill the tub or some kind of receptacle with water.
Well, it's like an actual, like a rented kind of pool.
It's a birthing.
It's like an actual birthing pool.
Okay. Okay.
That they set up. I just filled up my tub just to have all my contractions in. But even that, because I had one contraction outside of water, my second birth, and I remembered how all of them felt during my first birth, and it was so much different. Because I remembered just how awful all of them felt during my first birth, and that's how it was the whole time. The second one, the labor was nowhere near as bad. Like, I could breathe through everything. I was taking breaks, resting. Like, it just kind of, I mean, it's not like easy still, but it still just went smooth and nice. I was able to like tell my husband what I needed. I was like, where I was almost in panic, like fight or flight mode, the first birth.
Right.
And things just kept freezing up because I constantly had people telling me like, well, if the baby's heart goes down here, we're going to have to take immediate C-section. If this doesn't happen, if you're not breathing, like everyone was just in my face telling me like worst case scenario of things. So I couldn't even focus on anything. Right. And I couldn't like focus on like listening to what my body actually needed. So here at home, it was just like Shannondoah said, just peaceful. And I could just be like, okay, this is what I'm feeling. This is what I need. Now it's time. Like,
that's great.
Yeah. Where at my first birth too, I was told I couldn't push like when I felt like I needed to because the doctor wasn't there.
Right.
So, but I was like, I need to push. Like I need to get the baby out. But like they were physically telling me, no, you cannot. Like, do not push. So even that alone, I was like, this is crazy. So it was just nice. Like my second one, I got in the water. Shannondoah was like, all right, so you're only at 8.5 maybe centimeters, so it could be a little bit, but let me know what you feel. And within like the second contraction in the pool, I was like, I feel like I need to push. She's like, all right, go ahead. So I was like, I feel like I'm gonna have this baby.
So your whole like the belly is all underwater then when you have the contractions, or no?
I mean, it depends on how high our mom has it, but yeah, a lot of her belly and her bottom is underwater.
Is underwater. Okay.
It depends on the position they're in too. So if they're squatting, that's a big thing about having a doula or midwife, someone like that, a birth advocate. They can help you move positions and tell you, like, oh, let's try this now, or if so in the hospital, most doctors want them to semi-recline, which is actually the worst way to deliver a baby. That's why they get stuck so much. But if you and you can get shoulder dystocia
because you're pushing like
it's just not
gravity.
natural.
True.
Yeah. So one of the main things we do is we switch positions and.
Oh, okay.
And like help moms actually push. And so in the water birth, they can be in whatever position they want to be in as long as it's underwater. So the baby's coming out into the water and then we bring it up. But if the baby comes out in the air. We don't want to put him into the water once he takes a breath.
Oh, okay. All right.
Although there is a Laboya bath, that's how I was born, which is a baby being dunked into the water right after they were born, but it has to be very quick.
Quick. Mm-hmm. Oh, okay. Wow. I'd love to see that.
I know, it's really cool. I mean,
it's really cool. So, Shannondoah, what has been your most satisfying experience as a midwife and a doula?
Ruby's birth.
Aww.
Yes.
Really?
Yes. It was just the...
Why is that?
I mean, all of my births are amazing and satisfying, and seeing a mom come into her power, but knowing Ruby's first birth and being there for it, and then being there for the second birth and seeing, like, just the satisfaction, the pride, that just amazement in her own body
right
and
after it
face.
came out, I was like, oh my God, that was so much better. I was like, this is great.
I mean, it's satisfying to see somebody be able to, like, come into their power. And, like, even, like she was saying at the hospital when the nurse was just saying, don't push. Of course, I say, you push if your body tells you to push. Like, I'm always in her ear going, you do what you want to do. But, yeah, so she still pushed. But, it was like, but they are telling you to stop. Whereas in that home birth, she could just do what her body told her to do. And it was just so, like, satisfying and beautiful and just exciting. And now I get to be part of both of her sons' lives.
That's
it's like
awesome.
And their births, you know.
Yeah.
So that's really, like,
I know my first son was there around the pool too, like when
Yeah.
the baby came
Oh,
out.
really?
So everyone was there. Yeah.
Wow,
It was really
how
special.
cool was that? So I was gonna ask you, Ruby, what has been your most satisfying experience in relation to using a midwife and a doula?
Oh my gosh. Well, let me preface it by saying I think Shannondoah is an exceptional one, so I can't speak
awesome.
to anyone else because I was like, I would never want to have a baby without her again.
should I leave the room so you can tell the truth? No, I'm just
Yeah, it's really just because I always had in my head this idea of how I wanted it to be, and with Shannondoah there, it was pretty close. Like, it was very, like, I felt like I actually got to go according to my plan, and I had someone who understood and listened and then helped make it happen. Because, yeah, I mean, even from, like, my mom giving birth at home, all of her children, it was what made me kind of want to have them at home, but also what kind of scared me, because I was like, I don't know, like, I don't know if I can do that, and just the initial, fear of the pain, the unknown, everything, and she kind of took that away and just, like, led you down, was like, this is great, it's going to be great, you're great. Like, and then it was. Yeah,
That's
it was
good.
It was really nice getting to actually fulfill what I wanted, like, my plan in my head, and it happened.
And I hear that some moms just tell the doulas, I said, I don't want my husband here, I just want you. Is that true?
Yes, it does happen. Yeah.
But
It
that's
happens?
what's so
Yeah.
nice about, like, Shannondoah is I feel bad for a lot of the dads because that's such a helpless feeling. Like, that's
Of course.
to
yeah.
watch, like, your woman in pain and you can't do anything about it, and, like, men are usually solely just there to, like, help you, and they physically can't. So with Shannondoah there, when I had it in the hospital, she really, like, made sure my husband knew exactly, like, what to do, what would make him feel helpful, what was actually helpful, like, so he didn't feel just so helpless. So she gave him control and him power too, which I feel bad for the dads, because that's just as exhausting having to sit on the sidelines and watch as it is doing it. So that's also what's really nice about her. I can't speak to others, but
Right.
she really makes them feel part of it.
Yeah, actually, one of the reasons I became a doula was my own experiences with birth. And my husband's amazing, like, most fantastic father, husband. But he was like a deer caught in headlights, and he was not very helpful.
Yeah.
And so that it's one of my goals is to make sure that the partner is as present and capable as possible. So I work with all of my all of my partners, My mom's partners, not my partners. But I work with all of them so that they also feel a sense of like pride in what they were able to do for their partner. You know, I mean, that's pretty amazing. They don't feel like they were just sitting back and watching.
Yeah,
it's like, you know, they were part of that whole experience. And some dads really step up.
Yeah, that's true. So I know that there are many differences between the traditional medical birthing process and the midwife and the doula support in the care for a pregnant or a would-be mom. Also very extremely challenging, like you guys had alluded to, with a hospital birth and, you know, with the use of the support of the midwife and a doula, causing some friction maybe between all parties. We do know that, right? Yes. People are, you know, more trained. Why are they here and all that? And then, of course, mom says, I want her. And so that causes a lot of friction. So do you have any suggestions on ways as to how nurses, midwives, Montrices, doulas, and moms can all get along to get the same outcome? So
I do get it, especially for the nurses, especially if they've worked with some nasty doulas or midwives that are aggro, you know, like a little extra in their advocacy, and they, you know, I get that. So sometimes when I go into a room, immediately the nurses' hackles go up and like, this is my room, I control it, you don't control it. And they think that the doula is there to control things, and they are not. They are supporting mom and dad, and they are trying to get the birth as close to the plan as possible, but trying to get mom a beautiful experience, but to try to keep mom safe and happy and baby safe and happy, and that is really our goal. So if we are both have the same goal in mind, which is healthy, happy baby, but also we're listening to the birth plan, we're listening to the mom. That's the most important thing, is that we are listening, paying attention, being attentive, being empathetic. Maybe you don't have an empathetic bone in your body, but you know, you could be sympathetic, and you can at least understand where they're coming from. And that is hard when people haven't had children themselves. So I get where people are coming from, but there's definitely a way we can come together. And I think the first thing we need to do is we need to listen to mom, pay attention to what she wants, what her needs are. And if she says, don't ask me if I want an epidural, don't ask her if she wants an epidural. If she says, I don't want an episiotomy unless it's an emergency situation, then don't offer an episiotomy.
So they should know that from the start, right?
Yes. And it's simple things like that. But if they, especially the nurses and doctors, know that we're a team, we're there to be their teammate. We are excited to work with everybody. Of course. We're excited because we have the same passion. You're passionate. Most people choose labor and delivery because they're passionate about birth, at least in the beginning. Sometimes they get jaded, but I mean,
true.
Sorry.
No, that's all right.
You know, it's the
work as a team, right?
We want to be a team. You know, that's what, we came in on mom's team, though. She chose us. So if she chose us, respect that.
Correct. Do you have anything to add to that, Ruby?
I agree. Like, it's
totally.
Yeah, I keep getting flashbacks of my first hospital birth, and we had talked about kind of how it would be before I got there, and it was very like, because she was telling me, she's like, you're not going to want to answer any questions, and they're going to be asking you questions. So that's kind of what we went through with, as far as being like, this is the plan. If they ask you this, what's your answer? So that she could kind of take over. And then it happened. I was like shaking in just labor because I was I didn't expect the pain. I didn't know what to expect. So on top of that, people are still asking me questions that I'm like, I can't even think right now, or things that I'd already said that I didn't want, and I'm being asked again. Like her, she's like, so, like she said, I was like, I don't want to answer any of these. So the fact that she already knew, and she could kind of be like, no, she's not interested in this, or like, she could explain to me what they're asking is, do you want this? Because they would come in, say something. I'm like, I don't know what that means. Like, you know, it's so, and she'd be like, that means if you do want it, this is going to happen. If you don't, then this is going to happen. Or same with, I actually did say I wanted the epidural at the hospital at the very end because it was getting so bad.
Transition.
So then they brought it back in. So they brought it in and she whispered in my ear and she was like, I'm just going to tell you one more time that you can say no all the way up until they stick you. I was like, okay. So then he got in, everything was ready, and I was like, I don't want it. So then we sent him away, and she's like, I'm just here to remind you what you wanted to do. No judgment. Again, let me say, I'm not pushing any way you want to do it. I'm 104, like epidurals, hospital, like however you want to do it, just as long as it's how you want to do it.
Correct.
And that you're aware.
Right.
Absolutely.
So for me, I was aware that I did not want an epidural, and I did not want a episiotomy. I did not want to be induced. Like, so all these things. So when it came time, when I'm in a lot of pain, to have that person just be like, hey, this is what you were saying you wanted so much. No judgment, but, you know, just to let you know, like, it helps so much.
Very good.
Yeah.
It's not my job to judge. Like,
yes.
And I think that's really important too, is that I can only speak to myself, but there are people out there that think that they can push their own agenda with moms, and I don't think that's right. I think it's our job to be their support person and support what they want, not what we want.
Not what you want. Correct.
Yeah.
Right. Wow, this was very, very enlightening, ladies. So I would like to ask you what your message is to the community with regards to alternative birthing care. So let's start with you, Ruby.
Just that there are options. And again, it's really just whatever you want. I would say don't be afraid to explore. But at the end of the day, it's your birth and it's your experience. So just being as educated as possible and really seeing the options. And just making sure that what you want to happen actually happens. Because you do have a voice and control in or out of the hospital. So just knowing that there are alternatives always.
Very good, very good. And Shannondoah, what's your message?
I couldn't say it better. You have a voice. You know, this is your body, your child. You should be able to do what you want with it within reason. Now, of course, we have interventions for a reason, but we shouldn't push them just because we want the baby to come out faster. Or, and because one intervention, you know, starts a snowball effect for others. So just be aware of, you know, what your options are, but also what your personal desires are and what you want. Then also, just for all the medical professionals, like, we truly do just want to work with them and be a team with them. So if they could just see us on that side of things instead of, you know, this is somebody that's trying to control it, and because I've had nurses tell me to shut up. Because I was literally telling them exactly what my mom told me to say, and they're like, no, shut up. I'm talking to your, you know.
Wow.
Yes, to the patient. So if we just come in with kindness, you know, and lead with kindness, I think that goes a long way in life in general. So I think that's a really important thing to remember, to lead with kindness.
Yes. Absolutely. Well, thank you very much, Shannondoah Dartsch and Ruby Joslin, for joining us today. We are looking forward to you being part of our speaking panel at this seminar on Saturday, March 2nd. So thank you again. Thank you. If you are in need of the services of a midwife or a doula, you can contact Shannondoah Dartsch, and you can actually find her on the web. She has the Las Vegas Doula Services. And number is 702-371-3348. And you can get her on lasvegasdoula@gmail.com. Did I get that right?
Yes, that's right.
Good. And of course, please join us at our PNANV seminar on March 2nd and Getting It Right from the Start, Maternal and Child Health. You can still go to our website to register at pnanv.org. And thank you so much, and we hope to see you there. And to our Philippine NARS audience, we leave you with this. Every pregnancy and birth is unique, and we need to address the many factors, including the inequalities that affect health outcomes, especially sexual and reproductive health and the rights and the gender of the people. This is fundamental to ensure that all women have access to these, and to be respectful and highly of the high quality maternity care that they do and everybody provides. But there is a choice, but we have to look at this. And in the end, it's still the choice of the would-be mother and their families on how to get this achieved. So it is a choice that must be respected by all. Thank you again for joining us today. Thank you for giving us the privilege of your time. This is Doris Bauer, your Philippine Nurse host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you Philippine Nars, news and features about the Filipino American nursing community and beyond.